An outbreak of plague has been occurring in Madagascar, with more than 2,000 cases and 170 deaths reported since August 2017. This island nation is one of the few remaining hotspots for plague in the world, with cases usually reported between September and April each year. But this outbreak has been unusual, as it has affected many different areas in Madagascar, including heavily populated cities. What is plague, and how is it treated? Plague is a serious disease caused by the bacteria Yersinia pestis. It has a high death rate if untreated. There are several different clinical forms, including bubonic plague, affecting the lymph nodes, pneumotic plague, affecting the lungs, and septicemic plague, involving the bloodstream. Outside of outbreak situations, deaths from plague are usually due to delays in recognition and diagnosis, rather than a lack of treatment options. Although antibiotic-resistant strains have been described, plague can generally be treated with a number of commonly available antibiotics. Why does plague still exist? Plague was responsible for hundreds of millions of deaths in 3 devastating pandemics, including the plague of Justinian in the 6th century, the Black Death in the 14th century, and the third pandemic that originated in China in the 19th century. In these pandemics, it's generally thought plague was introduced by rats, often transported on ships, then transmitted to local rats in domestic settings. Fleas then transmit the bacterium between infected rats and humans. But there's still some debate on the transmission pathways of plague in these pandemics. The classical cycle between an animal reservoir, rats, to humans through an insect vector, fleas, is common to many animal-associated infectious diseases, known as zoonoses. The pattern of plague cases seems to have changed to a more complex ecology over the past 50 years. There has been a shift in cases from Asia to Africa and the re-emergence of disease in other areas such as the United States. It's now recognized there are many potential pathways of transmission from animals to humans in different settings. In the US, plague is thought to be transmitted from wild rodents in rural areas, such as prairie dogs and rock squirrels. In some African countries, it's thought cases arise where there is human encroachment into forest areas. Outbreaks have also been linked to the consumption of infected camel and goat meat in Libya, and from exposure to infected guinea pigs during preparation for cooking. In recent years, there's been interest in the impact of climate change on the potential for outbreaks. The prevalence of plague in animals in Kazakhstan is associated with higher temperatures in spring and rainfall in summer, as are outbreaks in the US. Tree ring studies also suggest similar climatic conditions may have triggered the Black Death and the third pandemic. How can it be controlled? Modern plague control includes finding cases and treating them, and where cases are detected, clearing homes of fleas using insecticides. Plague cases in hospitals need to be cared for safely to prevent spread to healthcare workers and other patients.